Hello, my name is Adam Khan and I have recently completed an MSc in Sport and Exercise Psychology at the University of Roehampton. This presentation will give you a brief overview of my research, which looked to assess the effects of combined action observation and motor imagery on self-efficacy and performance for a football dribbling task. Both action observation and motor imagery are common techniques which have been shown to be effective for improving motor skill performance. However, these two techniques have been typically used in isolation and often compared against one another. Recently, studies have looked to combine the two techniques, with results indicating greater positive outcomes for motor skill acquisition. Research is yet to examine the effects of this combined technique on important psychological factors for performance such as self-efficacy. Therefore, the main aim of this study was to assess the combined effectiveness of action observation and motor imagery on physical performance and self-efficacy expectations for a football dribbling task. A single subject case design was adopted for use in this study. The study was split into three 5-day periods, resulting in a total duration of 15 days. The baseline and retention phases were identical in terms of procedure, with the intervention period following a similar procedure with the inclusion of the action observation and motor imagery intervention. The participant in this current study was an 18-year-old male recreational footballer with 13 years experience of playing on the right wing. There were three dependent variables assessed in this study. The first was self-efficacy, which was assessed using a task-specific questionnaire developed for use in this study using Bandura's guidelines. Objective performance was assessed by the participant's overall time to complete the task, and subjective performance was assessed by a qualified coach, providing ratings from each recorded attempt that the participant made at the task using a subjective checklist by watching a recording of the attempt. The intervention commenced with the participants standing at the start of the course with their eyes closed while they listened to a 2-minute imagery script, of which a small extract you can see on the slide. The script was pet-based in nature, so focused on the feelings and sensations involved with completing the task. The participant was then exposed to a video example of an expert completing the course with no mistakes involved. The participant watched this video twice before each of their 5 practice attempts. Before each watch, the participant was guided by the prompt as seen on this slide, which was to facilitate the combination of action observation and motor imagery by reminding them to imagine the sensations and feelings involved with completing the task as previously explained in the audio. The task involved 4 balls placed at the end of each set of 6 cones, with 2 cones a further 10 meters away at the end of each section, forming a passing target gate. To increase complexity, time penalties were enforced on each occasion. The participant contacted the cone, lost control of the ball within the area, and missed the passing gate, each adding 2 seconds onto their overall time. After completing their 5 practice trials, the participant was granted with a 5-minute rest period in which they completed the self-efficacy measure. On completion of this, the participant completed their time trial and their overall time was calculated. The qualified coach would later watch the recording and provide their subjective ratings. Both visual and statistical analysis were performed to assess the effectiveness of the intervention in comparison with the baseline and retention phases. For self-efficacy, there was an 18.28% increase in mean scores between the last 3 trials of the baseline phase and the first 3 of the intervention phase. This was an overall large effect represented by a Hedges G of 2.21. Self-efficacy continued to slightly increase with the removal of the intervention, represented by a mean increase of 0.57% and a Hedges G of 0.16. There was a 10.08 decrease in overall time to complete the course from baseline to intervention, representing a significant improvement in task performance with a Hedges G of 1.82. The mean overall time was seen to increase in the retention phase with a 1.61% rise, representing a small performance decrement highlighted by a Hedges G of 0.44. An overall 12.96% increase was seen for subjective performance ratings from baseline to intervention. This was also a large effect represented by a Hedges G of 2.42. From intervention to retention, there was a significant mean decrease in subjective performance ratings of 5.33%, a further large effect with a Hedges G of 1. Indicating a further instance of performance decrement and removal of the intervention. Overall, the intervention was seen to be effective for enhancing both aspects of performance and self-efficacy perceptions. There are multiple practical implications that can be drawn from these results, the main one being that combined intervention technique should be used by coaches to facilitate the improvement of current skills, as seen in this study, and the learning and acquisition of new skills. There is, however, a need for research to adopt more longitudinal methods, ideally over the course of a sporting season, to assess the long-term effects for both performance and psychological factors. Studies should also look to incorporate cognitive assessments such as the assessment of mental representation structures for understanding movement within this field of research to widen its scope. This current study was the first of its kind to extend the scope of AOMI research to a key psychological factor related to motor performance, but this needs to be assessed more thoroughly with more robust study designs. Thank you for taking time to listen to my presentation today.